So Copper Queen Community Hospital in Bisbee reached a critical point on Monday where they had to shut down their operating room to support other parts of the hospital. News 4 Tucson's Daniel McFarland has the story.
Bisbee is a small town. Like most small towns, there's going to be a smaller hospital in that area, and with staffing shortages and rising coronavirus, it's making things very difficult for hospitals like Copper Queen. Copper Queen Community Hospital shut down their operating room for the first time since the pandemic began almost 2 years ago. The main reason is staffing, which has been low across the entire state. Kathy Lodge is the ER manager for the hospital and has recently had to work as a floor nurse just to keep up with the number of patients.
Most of our managers are actually working the floor and taking patient care, doing, the same thing we have our RNs doing daily.
The staffing issue, paired with the increase in hospitalized patients with coronavirus, had the hospital shut down its OR, a decision that was not made lightly by the hospital, but was necessary to take care of the emergency patients that needed it most.
To be able to offer more support to take care of these critical patients while we worked to get them transferred out.
If we didn't have the COVID patients occupying a third of the ICU beds in the state, we'd be having no problems.
At this hospital, they had COVID patients taking up 4 of the 13 beds. This issue affects every hospital, but is especially bad among smaller ones like this.
I do have a daughter that works at a bigger hospital, and her manager hasn't been on the floor as much, and so it kind of surprises her when I say that, yeah, I had to work a 12-hour shift today. She's like, what? Aren't you the manager there? And I was like, yeah, but there's patients to take care of.
There are currently over 2,500 coronavirus patients taking up ICU beds across the state. From Bisbee, Daniel McFarland, News 4 Tucson.